Good afternoon. It's good to talk with you. I'm going to speak a little bit about, obviously, with regards to the Alexandrite laser and the elephant in the room. You've seen that most of the talks have talked about, or at least limited to what they could do to Fitzpatrick 1 through 4, and stretching that on just being a 4. I'm going to talk about Fitzpatrick 5 and 6. For the last 30 years, I've been practicing dermatology, Beverly Hills, primarily seeing on-screen personalities. In the last 5 years, what I've been doing is seeing what dermatologists have seen and treated very well. But the issue comes to cosmetics. The issue comes to looks and looks count, especially when we're talking about dealing with, again, on-screen personalities and what needs to be done. Makeup cannot hide everything. So historically, we know that melanated skin of color patients have pretty much been avoided or excluded with regards to laser protocols, pretty much from most aesthetic procedures. And what we want to do is to put to change that. We certainly know that there are more and more skin of color patients who are, one, available. So it makes very good business sense. It makes very good academic sense to have a better understanding of what happens to melanocytes. And from a truly just cosmetic point, there's so much work that needs to be done. We utilize the Pico Alexandrite laser with the focus lens and demonstrated that we had great clinical efficacy on the acne scars. We were not attempting to treat acne, although there were some patients who certainly improved on that. I would say that, and I like what one of the other speakers had saying, I think it was real life or that, we didn't press on them, oh yes, you must use your sunscreen, oh you have to do any avoidance of that. We wanted them to live their lives as they would normally do. The only pretty much exclusion we had, we didn't want them to be on isotretinoin, and we didn't want them to use any oral medications along the way. You can see clearly what it is with regards to the sex. It was 3 to 1, essentially, with the females to males. The age group averaged at 34, 100% of African Americans, and again, Fitzpatrick skin type 5 and 6. Let me go back for just a moment. I think that it's real important, especially when you're talking about the aesthetic parts. Now, we all know that most patients consider hyperpigmentation, any type of dyschromia, as being a scar. As dermatologists, we may say, oh, well, that's not a scar. It very much is for your normal and regular patient. So as we relate, or as I say, scars in here, I'm including just the patches or areas of discoloration, primarily hyperpigmentation. With this, we used our subjects, I should say, they were up to 6 treatments. We spaced them out at 1 month apart with a little leeway of having up to 2 weeks on either side. We used a wave lift of 755 with a spot size of 8 to 10. The average was about 1,500 pulses that we would do per patient at a repetition rate of 10. For the adverse events, the pain score was between 3.7 and 2.4 out of 10. I can say that we did somewhat change in the middle, but did it more per patient that we had. We found that if we were to chill that area prior to the time that they had treatment and then to chill afterwards, the pain level at least expressed was considerably lower. Erythema was minimal with regards to these patients, usually lasting less than 24 hours. In fact, it was a stretch for one who went about 48 hours. There was no downtime. Patients were able to continue with regards to their regular activities. Whatever particular shows that they might be participating in, they could do their makeup. Real life. So you can see with regards to the hyperpigmentation, you look at those individual areas that are involved, there was improvement that happened. We saw this after treatment number 3. Again, with regards to seeing that from the deeper hyperpigmentation that these areas were clearing up just with regards to the use of the laser. Again, we did not have them do anything extra. I've been asked before, well, did you make sure that they were wearing sunscreen? The answer was no. With regards to this patient, you see there's a gradual and sometimes surprising, there would be a rapid decrease with regards to the pigmentation. And in no case did we get one where you could have post-inflammatory hyperpigmentation based off of the laser treatment that we performed on them. We also saw that there was a decrease at times with regards to the amount of papules that were involved, and certainly with regards to erythema, but by no means were we trying to use this as an acne treatment. Again, you can see it, just a consistent pattern of being able to get lighter with regards to the hyperpigmentation that was there. So in conclusion, this Alexandrite laser was shown to be safe and effective, and it changed the texture of the skin, improved the texture of the skin, along with dealing with the post-inflammatory hyperpigmentation, and specifically, again, dealing with Fitzpatrick's type 5 and 6. Thank you.
You can stay.